So you're a specialist and interested in direct care. Direct care is absolutely amenable to specialties, especially medical specialties. They already exist out there: rheumatology, cardiology, dermatology, endocrinology, sleep medicine, sports medicine, lifestyle medicine. You can absolutely specialize in direct care and set up a membership-based model. You can set up per visit model. And really, people are out there looking for more time and more attention and accessibility to specialists. So I'd say it's a prime market. First of all, thank you, IMGs. We love you and appreciate you. Second of all, family medicine, heck yes. This is fantastic to start to think about direct care if it's something you want to do earlier on. So the earlier on in residency you can start planning for this, you can start saving up capital for starting your practice, the better. I would definitely recommend going around and meeting other direct care specialists around the country or in your region. I would also recommend going to the DPC Summit and learning about direct primary care. It's the happiest group of docs out there, so that's always really invigorating to engage in. I would also recommend making sure that you know a little bit about business throughout your residency. It's something that they may not teach you in residency itself, but start brushing up on business and starting your own business and how you want it to look. If nothing else, it's just a lot of fun to dream throughout your training and get excited for what's coming after. Awesome question. So in direct primary care, we are always wanting to make sure our patients have transparent understanding of cost, right? And medications out there, you can get medications at cost for cheap. The long and short of it is, though, I'm like any other doc. I can write a prescription for my patient to get a med anywhere, whether it's compounded if that's appropriate, whether it's something that they put through their insurance or cash pay for. We have these conversations when applicable. And in our situation in Pittsburgh, we work directly with Blueberry Pharmacy, which is a local wholesale direct pricing pharmacy. And they're incredible because basically our patients have a pharmacy consultant right on our team. And they also save money whether they have insurance or not. Okay, so this would be a multiple part answer, but first thing I would do is learn as much as possible about direct primary care. So going to the DPC Summit, as mentioned before, amazing feeling, so much to learn there. Check out the DPC Alliance. If you are on Facebook, go on the DPC Docs Facebook group. Have somebody add you if you know another DPC doc on there because it's a wealth of information. Meet other DPC docs that are practicing in your area or around the country and learn about their experience. Follow us on Instagram, those of us who are doing this, and seeing what our life is like, because the biggest thing you can do is start to see how DPC is going to look in your life and in your region. And it's really important that you learn about your region and the marketplace of where you're going to practice DPC, because city, rural, places like where I am, where there are big healthcare systems, all the way to places that you're the only show in town, going to be a really different experience. The other thing I'll mention here is, what are you transitioning from? So my story is I transitioned to direct primary care from an employed position. I was an attending physician after my residency for 2 years and had a wonderful experience, but we were moving back home to Pittsburgh. So it was time to figure out what we were going to do when we came here. And I was offered jobs by some of the big healthcare systems here, learned about direct primary care, decided to go that path instead. But when I got here, I opened my practice from scratch. I didn't have a patient panel already. I wasn't already seeing patients in the city that, could transition over to my practice. And it really required educating the community where I was practicing about DPC and telling my story over and over and over again. The hustle is very real with direct primary care. You are selling yourself, and we don't learn how to do that in medical school or residency or fellowship, that's for sure. So the hustle is a huge part of that transition. I think like in any healthcare setting, there is a role for many members of a team. I would say that in direct primary care practices, a lot of solo practices exist where there's one physician and maybe one staff member and you've got your patient panel. But, as practices grow and you take on more patients, there's a lot of practices that end up hiring other people on their team, including NPs and PAs, and additional staff like office managers and MAs and nurses to all help take care of that patient panel. So I would say it's very practice size specific as far as a role for PAs in the practice, but as in any healthcare setting, it's all about teamwork, baby, and the best experience for the patient. Some DPC practices do hire. So note that finding one that's hiring somebody for their team is what you want to look for, right? DPCs that are hiring in my area and starting to put feelers out like that. Oh, this is
the most important question. So when I was in solo practice, I didn't have anybody to cross cover for me. So when I went on vacation, my patients could still reach me, or I was completely out and, they were SOL. And myself and my partner, Dr. Kirsten Lin, who owns her own DPC practice just north of the city, we joined forces several years back now and created a managed services organization, which is essentially a collaborative of other direct primary care practices. All of us are independent. We own our own practices, but we share a lot of things. One of those things is cross-covering for each other. It has been an absolute life-changing thing because now I can go off the grid for a vacation and one of my amazing colleagues is going to cover my practice, and we do that for each other. So, not only did we create a foothold in the city with DPC, but really a network of practices that now we can watch out for each other when we want to go away. Also, I think this question really lends itself to talking about communication guidelines and talking about patient expectations, because in the end, it's your practice and the way you want to run it is dictated by you. And your patients are going to understand that if you communicate clearly. So even now, even though I have people who cross cover me if I go on vacation, all of the other amazing docs that I work with, my patients know them and they know what to expect if I go out of town off the grid. I still reach out to all of my patients with ample advance notice to say, I'm going out of town. This is when, here's who's cross covering. I do a warm handoff in that way. But just like any of us, we just want to have good communication. But you, doc, deserve to have a life as well. So I think that sweet spot can exist with direct primary care as long as you have clear guidelines for patient expectations. Okay, this is my favorite question because I really like my week and I think I've refined it in a way that I look forward to and don't get the Sunday scaries. So Monday is my admin day. I do some self-care. I do house stuff. I also am catching up on work, and I really try to set aside creative time. So whether that's writing on Substack or working on social media stuff or really trying to think of strategic planning for my practice, but it's really like my day. Patients can always reach me, so I still am catching up on things, like labs and, responding to patient text messages. That doesn't stop, but I'm not in the clinic. Tuesday, I teach at Rebel Wellness and walk right next door and see patients. Wednesday, I'm on TV every other week, and I have patient care in the afternoon. Thursday, I teach at Rebel Wellness, see patients. Friday, I teach at Rebel Wellness, and then I have admin and meetings. But again, patients can always reach me, but I do all the drop-offs and pickups for school, and I have family time, and I have autonomy in my schedule. Hey, keep the great questions coming. Other boundaries that I set for patients, not many. Number one, respect, right? Mutual respect. So treat our office staff with respect, treat me with respect. Literally, I don't think we've really ever had an issue with that. And if we do, it's very easily resolved. And the other one would be communication style. So for me, a text message feels like that should be something urgent. So my patients know if there's something urgent, they text me. Otherwise, just shoot an email. So for me, that's my preferred communication style. They also know that if there are administrative needs, they can message our amazing office manager. If there are medical needs, you get in touch with me. So not so much necessarily boundaries, but again, communication style and helping them understand who to contact and when makes the workflow consistent and easy.